Hi everyone, welcome to this live Q&A. I'm Dr. Chris van Tulleken and I'm a doctor at UCLH and I work in our specialist travel service with Dr. Nicky Longley, who's joining me today. Nicky is a consultant in infectious diseases and a tropical medicine and travel health expert. And our travel service is a really, really special place to work. I feel very lucky to work there. I think of it as a service that can get almost anyone, almost anywhere to do almost anything. It's an incredible place to work. Nicky, explain a bit about the kind of patients we see and why we see them and how people can access this service, because it is unique.
Great. Thanks, Chris. So, as Chris said, we can see anyone of any age. So, we can see from tiny babies and newborns through to people who are pregnant, older people, and those with really complex underlying medical conditions. So, whether that's a severe allergy to a vaccine or a medicine, or living with cancer or HIV, or someone who's on a medication that makes their immune system not work properly, we can see them. And people can access that service either by being referred by their GP or their specialist or specialist nurse, or a pharmacist that feels that they are unable to cope with the complexity of the decision, or they can refer in themselves through a self-referral form on our website.
So it is an NHS service, and we do also see private patients.
That's
We
right.
don't get money from the private patients. That goes to the HTD charity.
Yeah, well, the money from the private patients goes in to help people in the service who don't have enough money to access the service to gain that specialist access.
Brilliant. So it's a very, very exciting clinic because one minute one patient might be someone in their 80s who's traveling to Everest Base Camp. The next patient might be under one going to a malaria endemic region with a parent in a very short period of time.
Yeah.
So it's a very exciting place to work. So you are talking with, I honestly believe, and this is true, one of the world's leading experts on travel health, travel medicine, on helping people get to remote or difficult places with complex medical conditions. So we would love all your questions. We have got a few questions being sent in advance, so we'll start with them. But do send your questions in. Ask literally anything you want about traveling with a health problem or the health risks of travel.
Yeah.
Nicky, we're going to start. How far in advance should someone start preparing for a trip from a health perspective?
Okay, so I think this is an excellent question, and it's one I think people don't give a lot of thought to. You often book your holiday and wait until the week before to get your vaccines. But actually, what we know is that it takes between 2 and 6 weeks to make antibodies to the vaccine. So people sometimes go to a pharmacist, get their jabs the day before. They're not actually protected until they come back. And
If you're getting a vaccination the day before a 1 week trip, you'll only have
you
immunity.
have immunity on return.
Yeah, the day you
The
day
day
you
you
arrive
arrive
at the
back.
earliest.
There's also things like, for some places that you go, you may need a certificate to get into the country for like a yellow fever vaccine. And that certificate isn't valid until you've had the vaccine 10 days before. So that's another mistake that people make, is they leave it too late and then they don't have a valid certificate and they may not be let into the country. Um, and then there's other things like malaria tablets, and some of those you can take last minute, but some of them you need to take for some weeks before to to get enough of the medication into the blood to protect you against malaria.
So it feels like ideally we'd love about eight weeks notice,
Yeah,
something like that. But it's worth saying in every single clinic we see someone. Most clinics we see someone who is leaving the next
the
day.
next day.
They're often living with something quite complicated.
Yeah,
They're going to quite a remote place, and I would say we can always do things to reduce their risk of travel.
exactly. And the other thing that I'd like to add to this, that about 80% of things that we can talk about that reduce the risk are not prevented by vaccines. So there's a lot we can do at the last minute by giving information. And some people don't have the choice to come early. There may be a family emergency or a bereavement overseas and they need to get out there quickly. So don't think, oh, it's too late, it's not worth coming for advice.
That's right, isn't it? And so much of each clinic we spend talking about, particularly the live vaccines like yellow fever vaccine, or
Yep.
we talk about anti-malarials, these sort of quite well-known risks of travel that there's a lot of risk management around. But in a way, it's the advice that we give around all the other things you do when you're traveling that's really important. And that can be done as you get on the plane.
As you get on the plane. And I think the other thing that's really worth bringing home is some people who've had something very complicated happen, like they've needed a bone marrow transplant or something else, they might start thinking about travel a year or so before they really go, and they don't know where they want to go. It's still worth those people coming and seeking advice early to say what might be possible and where are those risks. So don't feel like you're asking too early. You don't need definite plans. You can just get some sort of ideas in place as to what is safer or less safe.
And I think there've been quite a lot of patients I can think of specifically where they've come uh, with one itinerary, and we've said, look, this itinerary, I guess I'm thinking about people often maybe traveling through areas with malaria with very young children.
Yeah.
And we've said, look, you can do a similar trip. You just need to change the destinations a bit. You can begin and end in the same place, but don't go through that country.
Yeah.
And then actually you can have the same adventure, but you need to modify the itinerary. And we do itinerary modification quite a bit, don't we?
Yes. Yeah.
Next up, I really love this one because I think you and I might have slightly unexpected answers to this. What should be in a basic travel health kit? So I know you've had, can I say this? You've already had an adventurous holiday this summer. You've been to Scotland.
Scotland.
You've been to quite remote. So what did you bring in your medical kit? Was it a whole backpack full of a defibrillator and?
I think you have to be really realistic about this. I remember when I started it. Well, I remember when I first had a child, and I remember when and I now have 3, and the eldest is nearly 16. And I remember when I first started in this job, and you draw up a big long list of what you might do in an ideal world if you had a whole team of people to carry the kit for you. But if you're going to walk up a mountain with 3 children, you've got to be realistic about it, and also realistic what you can do with the kit.
And my current medical kit on my last holiday with 3 kids was essentially nothing. We even forgot the cowpole.
I always have some insect repellent. I have things that stop other people moaning, like a plaster or some antiseptic or some antihistamines. And I actually I think the key thing is to make sure you know how to access proper help, because if you've had a serious accident or injury, or if you're climbing in a mountain and the weather comes in, you need to make sure that people can find you, they can locate you, and you know how to phone for help, and you've got insurance that can cover that.
And that planning is more important than bringing emergency medical equipment to deal with injuries,
Yeah,
I would say.
When I lived in South Africa, I carried around for 5 years a whole load of intravenous fluids and cannula and things, and I did not use it once. And it was just very heavy, and I'm not sure I would do that again unless I was leading an expedition with other people and you knew that you could use it properly.
I think the one thing actually, and you mentioned this when we were talking about this talk, is sunscreen. Sunscreen is a really important, think of it as a medical supply.
Yeah.
And I say this as someone who got burned a few weeks ago. Stuff to shut kids up. I'm just going to refresh this. Do we do that for the new post? Yeah. Okay. Oh, here we go. We have got some questions. Sun creams, are they much the same, or are premium branded, more expensive sun creams better? I know the answer to this. Sunscreens are pretty well regulated if you buy them in the UK, and your cheapest sunscreen will work just as well as your most expensive sun cream. Same is actually true of sunglasses.
Yeah. One thing I would just add to that is, if you have sensitive skin, have a look at all the other stuff that is added in that isn't the sunscreen. So some of the perfumes and I guess sort of other things that make it a bit jazzy. If you've got eczema or psoriasis or something, just make sure those aren't going to irritate your skin.
So I have a child with eczema, and we spend a lot of time thinking about this. And the mineral sun creams, so the ones that act as a physical block rather than a chemical block that turn you a bit white, are often much kinder on the eczematous skin. One here from Alexander. Hi, Dr. Longley, Dr. Van Tulleken. I'm traveling to Thailand. I've seen conflicting advice about which vaccines to take, especially if rabies vaccine is needed. Also, does the NHS provide travel vaccines, or are they bought privately? Okay. So traveling to Thailand, which vaccines are needed and is rabies needed?
Okay. So
What would be
I'm going to deal with the last point first on this about are vaccines bought privately or available on the NHS. The majority of vaccines for travel have to be purchased privately. There are some vaccines that in primary care at GP services are available, and those tend to be the hepatitis A, typhoid, and slightly strangely cholera, which is one that we don't recommend very often, and your tetanus, your diphtheria, tetanus, polio booster. All others are generally, you have to pay for them wherever you go, even if you seek the advice in a travel medicine service on the NHS.
So you will pay people, if patients come to our service, they will pay for that.
They will pay for their vaccines. I think in terms of what would you advise, and there will be conflicting advice, and some travel health providers will say, look, get them all, and other people will say, let's have a look at the risk of what you're doing, how long you're going for, and what vaccines you've had before, and do you really need those for this specific trip. So I'm not going to go into the sort of nuances of.
Is it worth signposting to the National Travel Health Advisory Centre?
So the NAFNAC website, or Travel Health Pro, is a really good free open access website that if you click on the country, so if you clicked on Thailand, they will give the recommended for all vaccines and then the for some travellers on there. So it's really worth having a look at that.
Yeah. And there'll be and rabies, I think, for Thailand will be an optional
thing.
But you can look under there if your itinerary includes certain activities, then it would be more recommended. But for a traveller who's not doing those kind of things, you're not working with animals, then it would be an optional thing that you could have.
I'm going to just take this second to talk a tiny bit more about rabies.
Yeah.
Because I always think that the rabies vaccine it's safe. Once you've had a course, it lasts lifelong, and it is like an insurance policy. So the likelihood of being bitten by an animal is small, but if you get rabies, then the outcome is really bad. And almost everybody who gets actual clinical rabies dies. So I know there have been 1 or 2 cases in the literature, but I think by and large, people die from it. So if you have the funds and if you are going to travel a lot extensively, it's something that is worth having. If this is a one-off trip for a week and you're somebody who is staying in a resort and you don't run, touch animals, play with balls, go hiking, you may decide that it is not essential.
That's how I think of it. Rabies is the most deadly infectious disease.
Yeah.
So I have a low threshold for suggesting it, and the price varies a lot, doesn't it? Okay, I'll refresh that because it's nice to deal with the new questions that come in. In the meantime, what is the best way to avoid diarrhea and vomiting, stomach bugs, gastroenteritis, food and waterborne diseases while you're traveling? So, what are your top tips?
My top tips are almost 40% of people who travel will get some diarrhea. The single most important thing is hand hygiene. So washing your hands with soap and water reduces your risk of getting diarrhea by up to 50%, depending on what data you look at. You obviously have control of your hand washing, less so on other people who are preparing your food. But what we would say is avoid ice, usually, because that's very rarely made from bottled water or filtered water. Buffets in places where the rice and the salad and things have been sitting out in the sun for days on end tend to be higher risk than somewhere that has a high turnover of well-cooked food. And try and get your children to wash their hands is what I would say.
Do you think, is it worth saying it's also not possible always to avoid DNV, especially if you're traveling to low and middle income countries?
Yes.
I would say you and I are careful travelers, or we're fairly expert travelers, and I have not been able to avoid it on every trip I've made.
Yeah, I think that is fair.
Particular pitfalls are like places where there isn't repeat custom, where they don't necessarily have a great investment in protecting you from food poisoning. So places where local people eat are often better than airport food or hotel food.
Yeah. And I think the other thing is thinking about the water that you are drinking, making sure you have enough of it if you're going somewhere more remote. And if you don't, that you have the facility to really make sure that it's clean. So if you boil it, make sure you can boil it for 5 minutes. And if you've got some sort of some either filtration system or something like, iodine or a chlorine tablet or whatever to if you're going very remote. And being aware, I think the other thing that people often don't realize is that the boiling point of water changes when you're at a higher altitude. And there are very clever apps that tell you how long you need to boil the water for if you're trying to climb up Everest.
And I have fallen foul of that, failing to boil water at high altitude and getting a parasitic infection called giardiasis, which is one of the very common things we see when we look after patients who've been traveling, who've come from abroad. It's one of the common causes of diarrhea.
Yeah.
We also now see it in UK wild swimmers and surfers.
Yeah.
It is also, you can get it from
Yeah.
swimming in UK water.
And I go, one last point on here before moving on. If you're buying bottled water, make sure that the bottle is truly sealed and it hasn't been refilled by somebody and then they've just done the top back up, because often that's a way of making money.
You want to unclick the bottle
Unclick
yourself.
the bottle yourself, yeah.
Quite a few questions coming in. What are your thoughts about the risk of Zika virus, which is a mosquito-borne viral infection, when traveling to affected countries and trying to conceive or pregnant? This person's heard mixed opinions on how high the risk actually is versus the NHS advice of just don't travel to any country with reported cases. So Zika virus, a virus that can cause birth defects in unborn children, transmitted by mosquitoes, and it's quite widespread across the tropics. How do you think about this? Because I see a lot of patients who have traveled whilst pregnant, come back, expose themselves to Zika, and then we deal with the fallout of that.
Yes. I think it's a really difficult one to answer this. And this is very much where we'd say it's an individual thing. And I would just recommend somebody sits and talks this through, not just with one of the couple, but assuming if you are in a relationship and you're wanting to conceive or pregnant, making sure both of you are on the same page. It's one of those things that the testing for Zika is difficult. So unless you have a fever and you've been to a Zika country, we can't do a reliable test to say whether you've been exposed. So it's how do you sit with the risk, even if it's small, that something may have happened to your unborn baby. And this is why the NHS advice is quite blanket, but it's something we can really help to navigate. It's a very difficult one. It also boils down to how much do you want to or need to do that trip. So if you could go somewhere where there isn't a Zika risk, and you may get to the point when your baby is 6 months old and they're sitting up late or not meeting their milestones, and you always think, was that because I got Zika and I didn't know about it? You've got to sort of feel confident you can live with that, even if it's unlikely that that was the cause.
I think that's right, isn't it? The absolute risk is often extremely low, but the long tail of anxiety and the difficulty in having certainty then can last for years.
Yeah.
And so I think we that's why often, even in places without much Zika, if there's a risk of Zika, we say, I always think we ask people to consider not going rather than we say you shouldn't go.
And there's a lot you can do to reduce that risk if you do need to go. So if you have to go for a really important reason, or you realise afterwards, there's a lot of reassurance we can do, and we can talk about bite prevention and look at rates, but we're not going to be able to give you that absolute 100% certainty. So it's how you stick with risk, I think.
And that's a lot of our consultations are talking about the risk and how that risk is going to feel when you're there.
Yeah.
And it's not telling you what to do, but it's helping you work out how you're going to feel while you're there and afterwards, and avoiding the kind of regret. Nicky, is it worth wearing an FFP3 mask or an N95, a really good mask to reduce the risk of infections like COVID? Do you wear an FF?
I mean, this actually says on the plane.
On the plane, sorry.
And so what I would say is actually being on the aeroplane itself is generally pretty safe. They have the HEPA filters, which are the very good filters that you have in a hospital theatre that filters out the air. So unless you have someone sitting directly next to you or perhaps right in front of you that turns around and coughs in your face, your risk on the plane is small. It's more likely to be the risk from touching surfaces and then eating, or in the airport, which is essentially a big hangar of people standing around, massive masses gathering. So I don't feel strongly about wearing an FFP3 mask on a plane. I think if you were feeling very anxious or had a medical reason to really be concerned, it may be that airport transport or that public transport that you're wanting to think about your risk.
There may be some patients who are very vulnerable
Yeah.
to particular airborne infections where they may want to reduce that
Yeah.
risk. But the plane, basically, a modern jetliner has some of the cleanest air.
Yeah.
Particularly, even the newest aircraft have some of the cleanest air of anywhere you
Yeah.
go. Yeah.
And people make the mistake of going, I got on the plane and then I got sick. It's actually, I was in the airport and I was on a busy tube on the way to the airport and then I got sick.
Early in the morning,
Yeah.
panicked, slightly immunocompromised by missing a night's sleep packing. I went abroad this summer and we haven't pre-screened these, and brought many sunscreens from Lidl and Aldi as they were almost half the price of branded ones. Are all these the same? Yes, I think that's a great choice. And the only concern, as Nicky said earlier, is about how they interact with more sensitive skin. Let me just refresh this. Is it safe to eat salads and fruits in hotels? The travel nurse at my GP surgery advised not to, as we cannot be sure if the water they're washed in is clean. Do you want to nuance that, Nicky?
I'm going to nuance that slightly. So I'm going to say the first thing is, where are you going and which hotels and things? There's this sort of misnomer about where water is or isn't, or tap water is or isn't safe. But if you're traveling across Europe, in general, most tap water is safe to drink. This doesn't mean that you won't have outbreaks of, norovirus or the winter vomiting virus in a hotel. And that again is about hand hygiene. If you are going to a lower income setting and one of only a handful of people staying in a hotel that doesn't have a big through flow, you may want to avoid things like salads and things that haven't been washed. But it's difficult. There's very little actual evidence. No one's really been able to do good trials, but your GP is right, but you can't guarantee what water the salad was washed in.
And the rule of, I'd say the difficulty with salad, some places it's grown using night soil, using feces.
Yeah.
It's hard to wash it because you can't use hot water. Yeah. You can't cook it. So a rule of either cook it, fruits that you can peel.
Yeah.
Or vegetables and fruits that you can cook.
I mean, we always have the cook it, wash it, peel it.
Yeah, cook it, wash it, peel it.
Yeah.
And watermelons are the interesting exception because they have very large pores and they can take up fecal bacteria into the watermelon.
You're ruining the watermelon.
Legendarily.
Chris, you're ruining the watermelon.
Well, there are lots of places in the world. It's very, very safe and delightful to eat watermelon, and local knowledge can usually be trusted. Claire asks, could you repeat the website which gives the information? So it's the National Travel Health Advisory Centre, but if you search Travel Health Pro, I don't know if it's .net or .com, you'll find it.
Claire has put it in there, Travel Health Pro. So they're both the same. It's just a very long, complicated name. But if you type in Travel Health Pro, then it will pull up the website.
Jeff is off to southern Zimbabwe in September, not the Zambezi Valley. Do we need anti-malarials?
So, Jeff,
I feel like this
is a great question. What I'm going to say about this is, like all good healthcare professionals, I don't do this off the top of my head. And with malaria, I always look at the country risk map because certain countries, it's seasonal and it changes and there are certain areas. So I would be pulling up the Travel Health Pro website at this point. We're doing a great plug for this. And I would just check the time and the seasonality. And if it says that it is a high-risk destination at that time, then 100%.
If the map is red.
If the map is red, take the
even if it borders, sometimes there's this slightly paradoxical thing where a country is bright red and you do need anti-malarials, but if you walk across the border, you don't. And that seems counterintuitive, but I am very, very binary about that guidance. The maps are designed very carefully.
Yeah.
And if the map is red, at the time of year you're going, you need the anti-malarials. And we can talk, should we talk while we're here just a little bit about anti-malarials? Because we spend a lot of time in clinic covering this. What anti-malarials, what are the considerations that Jeff or someone like him might be wanting to think about with the anti-malarial options? Because we've really got 3 drugs.
Got 3 drugs. And I think before, the one thing that I'm also going to say before we go into the nuances of the 3 drugs that we've got, that there is this whole A, B, C, D, E of malaria. And so being the fact that Jeff has asked means he's aware. So that's the first thing. And then it's thinking about that bite prevention. So you don't want to get bitten by the mosquito in the first place. And in general, the malaria mosquitoes bite from dusk to dawn. So thinking about wearing a good DEET-based mosquito repellent, having long, loose-fitting clothing, sleeping underneath a good treated bed net, or if you're in a room with air conditioning, make sure that the windows and doors are closed and your air conditioning is on. So those things you can do to reduce being exposed to the malaria mosquito or parasite itself. And then I'll let Chris, did you want to talk a bit about the medication?
Yeah, and it's the reason the awareness, then the B for bite protection is so important is the I think it's quite a common misconception. If you're taking anti-malarial tablets, they in some way stop you being bitten by the mosquito. They don't. They only protect you against the malaria parasite, which is injected by the mosquito. So the bite prevention, the clothing and the DEET protects you from lots of other viruses transmitted by mosquitoes, from ticks, from biting flies, from lots of other issues. The anti-malarials, there are 3 different drugs that we prescribe primarily. There are very rare exceptions. Mefloquine, which is also known as Lariam. There's Malarone, which is a combination of two drugs, atovaquone and proguanil, and then doxycycline, which is an antibiotic. Now, I would say of these 3, most of the time, my default, if someone's never had antimalarials before, is the Malarone, which you can also buy over the counter. It's called Maloff, I think.
Yeah.
And all of these drugs need to be taken while you're in a malaria endemic area, but also for a period of time afterwards. The Malarone is the shortest period of time afterwards. It's 7 days after you get back. But that's a really, really important point about these drugs is you have to keep taking them all after you leave the malaria area. And so I'm very binary. If someone has an itinerary where they dip into an area, a malaria endemic region for an hour, I say you need to take a full course of the antimalarial tablets, which in the case of mefloquine or doxycycline will be that hour plus 3 weeks afterwards, plus 4 weeks afterwards. And then in the case of Malarone will be 1 week afterwards.
Yes. And the other thing the other question we get asked a lot is if people were born and grew up in a malaria country and then have been living in the UK or somewhere else in Europe, they're like, do I really need to take malaria tablets because am I immune? And you actually lose that immunity really quite early. So unless you're exposed constantly throughout life to ongoing malaria, you become susceptible to malaria. So the answer is if you've been living and working in the UK for sort of 6 months, a year, 2 years, please do take malaria medication and make sure that your children get it as well, because it's really severe in children.
And we do, I mean, I always underline, we do see deaths from malaria every year in the UK. And it's often from people who, for very good reasons, think they might have immunity. An anonymous person's written, I was diagnosed with HIV in 1986. In that year, I was due to study in West Africa, was told I couldn't have the yellow fever vaccination. I finally saw a London consultant who said my immune system was still intact. I could have the vaccination. At the time, this lasted 10 years and I didn't have another because by 1996, I was unwell on antiretrovirals. This person's now in their 60s, very good health. They want to go back to West Africa. Now yellow fever vaccinations seem to be lifelong, but I no longer have the certificate from 1986. This, some viewers, this will seem like a very obscure dilemma. This is something we encounter the whole time.
Yeah.
Someone had the yellow fever vaccine a long time ago. It lasts your whole life, but in order for travel to some places, a certificate is required and people lose their certificates. Let's just have a quick.
I would say there is a slight caveat to that it lasts your whole life. In certain situations, when your immune system may be slightly compromised, there is a recommendation to have it boosted after 10 years. But it is nuanced and it's something that we would have a discussion with people. And that includes if you, as a child, you had your yellow fever vaccine before the age of 2, or if you had one when you were pregnant, you may need another one later. But in general, it lasts for life.
So in this, it's hard without all the numbers in front of us. What we mustn't do on these
Yeah.
calls is give specific clinical advice, but in general, I would say my reading of this is this person's yellow fever vaccine probably is good for life,
Yep.
or they're likely to have some residual immunity from it. And in their 60s, I think in our service, we would be quite unlikely to give a yellow fever vaccine to this person.
Well, I think apart from the fact that we know that people who have had a yellow fever vaccine before and have had no problems with it, there in all of the data, there has been no evidence that people having a second yellow fever vaccine are at risk. But it depends what else is going on. So it may be possible to give a second vaccine or a third vaccine if needed. What's more likely is it isn't needed because we feel you probably have some level of immunity. But whether you can get a replacement certificate depends on whether you know which clinic you had the initial certificate, the initial vaccine from. So you need to have all the information.
Which may be hard going back
Maybe difficult.
40 years.
Yeah. My advice would be to try and get an appointment with either us or another travel health service where we can talk all this through with you and go through the specifics and work out what's best for your trip. And for yourself, because sometimes the trips are actually not as high risk as you think in terms of the exposure to yellow fever.
Right. And we often will have a consultation like this where someone's traveling to West Africa and there's this dilemma about the yellow fever vaccine. But probably there's a number of safe options here we can sort through. And there's a lot of other things we'd want to consider about a trip to West Africa as well. Anti-malarials probably first and foremost, but lots of other things.
I think the key thing is I wouldn't let the loss of your yellow fever vaccine certificate make you feel like you're not going to be able to travel to West Africa. There are many safe ways of being able to do that.
And we can issue an exemption for medical reasons anyway. So I don't think I've ever said to someone they can't travel. We can, Louisa, my son has anaphylaxis to sesame and peanuts. We have EpiPens. We're traveling to Thailand for a family wedding. Is there any advice for managing meals whilst there? We've checked where hospitals are and informed the hotel. I have a card in Thai explaining this, but still very anxious, very understandably, because there's so much peanut in Thai food. Nicky, you deal with more with the allergy stuff than me. Have you encountered this before? I have not.
I mean, what I would say is that already, Louisa, you're ahead of the curve and lots of people haven't thought about this. And I was going to say, having the information there, phoning ahead, making sure that you've got enough EpiPens and a sort of anaphylaxis kit and knowing where reliable hospitals are, which you've done, so that if there is a problem, you can get there. I think if you're in a really remote and rural area, it would be around, do you need to prepare that food yourself? If you don't feel you have the assurance from the individual hotels, then it may be that you have to find a way of preparing the food safely. But I suspect in many of the bigger hotels, they will be used to this.
I would think so. I mean, one thing that you've underlined to me many times is that a single EpiPen is often not enough adrenaline to deal with. It's a bridge to get you to secondary care. So particularly for long haul flights, you definitely want, I would say, more than 2 EpiPens. And if I was traveling to Thailand, I would want to think about having lots of EpiPens. I would guess there's a lot of information. There'll be an online community of peanut allergic people who have traveled in Thailand. I have a very good friend who lives in Thailand who has a very severe peanut allergy.
Yeah. And I think it's just remembering to yourself that, it's one of the sort of mantra things that I always say is that people never die from having too much adrenaline from an EpiPen. And so don't be frightened to use it, and make sure that not just you can use it, but the other people that your child might be with. So if you're traveling with friends and you leave your child with a friend for a while, make sure they know exactly what to do and you have the EpiPens with you. So if there is an incident, you know exactly how to do it and how to access it. And same if you're in a beach resort where there is a daycare setting, make sure that that kit is there and that you are happy that the staff know how to use it, just in case there's an incident.
Yes, and not using the EpiPen is more
It's more
dangerous
dangerous than using it when it's not 100% needed.
It feels like a very big deal doing it
Yeah.
because we've seen it in movies, but it's actually
Yeah.
a very safe thing to do,
Yeah.
obviously. Rahela, I'm worried about the anti-malaria side effects and it ruining my trip. I'm traveling to Tanzania and to remote national parks. How to manage side effects of the anti-malaria pills?
I would say the first thing is that there are 3 options. People can get side effects to any of them. Generally, they're well tolerated. If you're worried and anxious about it, I would get a test pack and try them in the UK to make sure they're okay, and then work through, if there are any problems, what the alternative options or how we could help manage side effects.
That's the most important thing is you can go and buy if it's the Maloff, which is probably the one that most people find most straightforward. If Malarone is what you're thinking, and you can go on the Travel Health Pro website and look at the differences between them, but you can just go and buy a pack and take a few days and see how you feel on it. And that's really important because these are drugs that we often prescribe to people for a very long period of time. So they're all safe, in the patients that they're allowed in. They're all safe for a long period of time.
If you were going to go away for 6 months or a year and you were wanting to bring the anti-malarial tablets with you, I would strongly advise getting a week to try way in advance to go, is this okay? Can I cope with this before going and then feeling in a bit of a panic?
And is it worth talking briefly about the different side effects? So the side effects that are probably most discussed is the neuropsychiatric side effects of mefloquine, also known as Lariam. And if you don't have a personal history of psychiatric problems or a first-degree relative with psychiatric problems, and that includes, I think, quite mild mental health issues, then you're not very likely to have side effects. Some people get dreams, nightmares, increased anxiety, but generally it's pretty safe for most people. Malaria people really don't get many side effects on in the big trials and in the patients that we see.
Bit of an upset stomach.
Sometimes a bit of upset tummy. And doxycycline can be really useful. It's an antibiotic, so female travelers sometimes get thrush, and there's a risk of photosensitivity if you're going somewhere sunny.
And a bit of sort of acid reflux, sort of ulcer type symptoms as well.
Yeah, so all of...
Yeah. No, I was going to say the other thing that I think is really important, I'm not sure is always highlighted, is that if you're taking the Malarone or Maloff, you need to take it with a fatty meal, so some yogurt or avocado or something else to help you absorb it. And I'm pretty sure that will reduce some of those side effects as well.
Yeah, and so really important that you don't do this casually, but you go and look at which anti-malarial will be best for you. But I would say almost everyone will find an anti-malarial they will be able to go and enjoy a trip to Tanzania without side effects really spoiling the trip. Hit the new posts. Nicky, is insect repellent with DEET or permethrin treated clothing recommended, or are there other insect repellent devices, potions, lotions, and chemicals that work just as well?
So the gold standard insect repellent is something that has DEET in it between 30% and 50%. Anything above 50% won't give you any added protection, and anything below 30% won't work so well. DEET doesn't work brilliantly for ticks, so we recommend if people are worried about tick bites and tick problems to treat their clothes or spray their their top of their boots and their trousers with permethrin, which is an insecticide, and you would never put it on your skin. And you've got to be aware of the runoff into, wildlife and water, etc., etc. But it works well against ticks. Again, for ticks, you wear long trousers, tuck your socks into your trousers and do a tick check in after you've been out and hiking. It's especially sort of prudent for people camping and in doing walking safaris and that sort of thing, is looking for the ticks. The longer they're on, so they've got to be on really for about 24 hours before they're going to give you anything. So do the sort of, it's a way of making great friends with the group you're trekking with, doing the groin tick check at the end of the day.
But or do it with a friend or relative.
I didn't answer the other question. Do you want to talk about something about the other devices?
Well, yeah. Is
Is
there an app that you can use on your phone? I mean, I'll ask these questions slightly facetiously. So we don't think that things like citronella candles, mosquito repellent coils, high-pitched apps on your phone, or little plug-in devices, none of them sufficiently repel insects. Eating vitamin supplements, garlic,
Yeah.
anything dark.
All of those dietary things don't work at all. Some of the other things, like the citronella and the coils, will work for a bit. And there are other non-deep formulations that will work a bit, but they don't last as long. And the key thing is you need to reapply the insect repellent regularly. So for DEET, it's about every 6 hours, more if you've been swimming, you're very sweaty, you're in a humid environment. For some of the others, it's more frequently. So it's what you can cope with. And it's always sunscreen first, insect repellent afterwards, and it reduces the SPF of your sunscreen. Don't put DEET on your clothes or wrap it in plastic, because it will ruin all the synthetic fibers.
Although it ruins fibers, I always think people are frightened of DEET because it dissolves the strap on their plastic watch.
Yeah.
But it's actually pretty benign.
It's really benign on skin. You don't absorb it. There's over 50 years worth of safety data. It's safe in pregnancy. It's safe on young children. You don't want to eat it. So avoid, if you're putting it on your child who puts their hand in their mouth, don't put it on the bit they put in the mouth, and wash them off before you put them to bed.
The taste of DEET and sunscreen is like, it's a real childhood memory, isn't it? What are the most common infection worries for people travelling in the UK? Are there many? We talk about far-flung exotic travel, but what about simple UK travel? That's a brilliant question.
That's a brilliant question. Do you want to start with that, Chris?
What would be my laundry list of things? So it very, very much depends on what you're doing. So if you are staying in 5-star hotels up and down the UK, you are at no more risk of getting anything than you are just living elsewhere in the UK. If you're wild swimming, there is a significant risk, I would say, of waterborne disease almost no matter where you're doing it, in the sea or in rivers. And if you get diarrhea afterwards, we're happy to see you at our post-travel service at UCLH. And you can there are a number of bacteria that are fecally transmitted. Lyme disease is a concern in some parts of the country, transmitted by ticks. Other infections that we want to worry about? What do you want to talk about? Watercress
Go for it.
There are very, you can in theory, I guess, it's slightly expanding infections and other things, not infections. Food foragers,
Yeah.
we do see. So if you're foraging watercress, you can get a fluke, a liver fluke.
Yeah, I would say sort of if you go across bits of Northern Europe that you wouldn't necessarily think of, we've had sort of incidents of the echinococcal hydatid disease from people foraging. This is a sort of horrible cystic liver parasite that people can get from eating wild strawberries in bits of Switzerland and across Northern Europe. I'm not sure how many cases have been linked to the UK, but certainly places outside of that aren't in supposed high-risk settings. I guess we were talking earlier about something called leishmaniasis, which is another parasitic infection that people who are older or have myeloma or other hematological problems are higher risk of, and we've seen increasing cases of that from Spain and Greece. So that's, let's not get paranoid. But
I mean, washing washing fruit that is at low level is generally a good approach to everything,
Yeah.
isn't it?
Yeah.
Uh, I'm trying to think of anything else we think about in the UK. I mean, there are, if you're nerdy about it, we are starting to see some of the mosquito-borne viruses move up Europe. So we now have transmission of chikungunya and dengue in southern Europe. Uh,
Very few cases.
very,
I
very
think it's very few cases. I don't want to sort of start a sort of a big concern. I think more worrying than that is things like you occasionally see these outbreaks of E. coli or the E. coli 0157 that you see from petting farms in with children who sort of touch sheep in the UK and then get a horrible sort of E. coli illness from it. So I think again it's about
raw milk. People drinking
milk.
raw milk on holiday.
My
We
very
we know people who've done that. That's always a risk, even if you're buying it from the farm gate.
yeah.
But the UK is pretty. It's a pretty. We're having. I think we're both having to rummage quite hard here
Yeah.
to find. There are other risks in the UK. Probably mainly our motorways are going to be the main risk.
That's a good question.
Um,
What
I'm traveling to Vietnam later in the year with alcohol poisoning. With alcohol poisoning there on the rise, are there any signs, anything I can do to ensure drinks are safe? I wonder if this person's asking about methanol poisoning rather than ethanol. So ethanol is the alcohol that is in wine, beer, all the spirits that people typically drink. Sometimes through accident or to save money, methanol, which is another related alcohol which tastes of nothing, ends up in drinks, and it can be fatal, and a very low dose can
yeah.
permanently damage vision or turn you blind. And there are some high-profile cases that have happened in Thailand and in India.
Yeah. And I think
Is there anything you can do to protect? I mean, it's really
I think what I would say is avoid, if you're buying drinks in a bar, you're better off having things that are in it. You've seen from if you're having a beer that is in a sealed beer bottle, it's very unlikely that is labeled and made externally. It's very unlikely, much less likely than if you have sort of a cocktail that has a local made spirit. But I mean, there were the tragic cases a year or so ago, weren't there? I think somewhere in Southeast Asia. I can't remember if it was in Laos, Cambodia. But this is going outside my area of expertise. I would say be vigilant, don't cut corners, and just be aware because there's increase of drink spiking across globally. So often when you travel, but also in London. So just make sure you could keep an eye on your drink and either you've bought it or who has bought it, and just be aware.
one of the things we do talk about in clinic is when people travel, they take risks that they would not normally take.
Yeah.
You feel a liberation when you're traveling. You're often in a place where you don't quite understand local nuances. You don't quite know what's safe and what's not. And we talk about, sometimes it's really important to treat yourself as if you are at home in the UK and don't do a thing you maybe wouldn't do at home. If you suspect you have malaria and go to hospital, what tips would you have for patient advocacy in a foreign country if you don't know the language?
So one thing I would say is if you have any underlying medical conditions or concerns or take any medication, it's very useful to have have a medical alert bracelet or your prescription, both in the language that you speak, so English, but also in the language of the country that you're going to. So if you were traveling with complicated medical history, try and have that translated before you go. I guess it's having good travel insurance and making sure that they cover you for your medical any medical admission or needing to be repatriated or moved to another hospital, and making sure you know how to access that and seeking advice from the insurance on the medical side early.
And that your insurance is up to date, that
Yeah.
if you had a heart attack or a new diagnosis in the last year and you have not told your insurance company, it may make the whole thing invalid. And we work with colleagues who tell us horror stories really of people who get repatriated and end up facing bills of hundreds of thousands or millions of pounds because their insurance was invalid. So getting valid
Yeah.
insurance, we spend a lot of time talking about.
Yeah.
Um, we're coming sort of toward the end. We've got time for a few more. Is there a universal anti-parasitic medication that can be taken before traveling to a tropical region, or presumably after traveling?
Yeah.
What would you say to
So
that?
I would say to that, in general, no. It's very easy to listen to this and worry that you're going to get vast majority of people go on holiday to interesting places, have a brilliant time, and are well and don't need to worry about it on return. Some people are at a higher risk, and that might be because of the trip they're doing or because they have underlying medical problems, or they're of an age where it's a higher risk. And if that's the case, come and see us and we can help talk about screening for parasitic infections. And your GP can refer you, and we have a clinic where we can do that. And there are many other clinics probably around the country that will help with that as well. I wouldn't universally recommend that people start taking different parasitic tablets because it's usually not necessary. There are certain things you can do to reduce your risk of getting parasites. So avoid walking barefoot, wear sandals instead. And if you're sunbathing on a beach, lie on a sarong or a towel. And fresh water in general. So if you were going, I don't know, for example, visiting Malawi, swimming in Lake Malawi, we know that puts you at a higher risk of something called schistosomiasis or bilharzia. So if you do that, then seek medical attention 6 weeks after return to get screened and treated.
Do you think it's fair to say that most parasites, because Nicky and I both also treat patients after they've been traveling, parasites are in general, we can diagnose them and we can treat them very effectively.
Yeah.
So we're happy to see you if you have symptoms. There's a set of questions here, Nicky, which I think are really nice. From a few different patients, I'm on an suppressive treatment for multiple sclerosis, desperate to go and work abroad doing animal research in West Africa. Is this impossible? Someone who's over 80 is asking if they could still travel to remote places. Another person living with cancer who's feeling frightened to travel but desperately wants to see the world now that they've retired. I think a lot of people find this. They've been saving up these trips of a lifetime, or they have a particular travel destination in mind, and then illness hits them and they feel very vulnerable. They're anxious to travel. What would you say to the community of people, some of whom may be listening, about whether patients living with serious illness can travel to remote destinations? I know we've covered some of this.
Yeah. I think that as long as you are aware of the risks and you take precautions to reduce those risks and you talk to an expert and get advice, we can usually help get you to where you want to go. And life is, there's so much more than the four walls for which you live in, and just meeting people, experiencing different cultures, being able to do these things are really enriching. But it's about having the information, planning in advance, making sure that you take any precautions and get any vaccines early, and sometimes can modify the trip slightly. So if there was a yellow fever outbreak and you were unable because of your medical condition to have a yellow fever vaccine, we may be able to advise you of somewhere that you can gain an equally enriching experience, but with some of the anxiety taken away. Does that sound?
I think that's right. I mean, I joined Nicky in this service. Nicky runs the service, and the thing I think that you are amazing at explaining to people is that travel comes with risk. All travel comes with risk when you leave your house in the morning, but not traveling often also I think comes with risks. And we often see people who have want to travel for a professional reason. They've got a job in a high risk setting, or they're visiting friends or relatives. There's a family emergency and they want to travel. And actually, not traveling for those people, staying at home, will make them feel terrible and will limit their lives. And I feel we can't always get rid of all of the risks of traveling, but we often can help people figure out the real risk of them getting yellow fever on that trip for that 2-week period is extremely low, and they shouldn't let that stop them traveling. I feel like that's one of the the kind of main things I've learned
Yeah.
from you. We are a help you get to your destination clinic rather than a here's the list of people that shouldn't travel to this list of places,
Yeah.
which makes it an inspiring place to work. Um, I feel like we've reached the end of our allotted time. It's so nice sitting with a friend and
Yeah.
colleague and asking Nicky these professional questions. I learn a huge amount doing this stuff. Thank you all, I think, for your amazing questions, for listening, and we may see some of you watching in our travel service, however you end up being referred in the months and years to come.
Thanks, Chris. Thanks, everyone.